So, hello students, and coming to a very important and a slightly difficult topic to understand, the ganglions of head and neck. Ganglions of head and neck. Now, as we know, students, we have got a central nervous system and an autonomic nervous system. Central nervous system, autonomic nervous system is made up of sympathetic and parasympathetic nervous system. Sympathetic and parasympathetic nervous system, right? Now, students, we take a section of the spinal cord. Let me just tell you this in short. We take a section of the spinal cord. Look, this is what we are going to get here in a section of the spinal cord. Okay, so that's the dorsal root. That's the ventral root, dorsal root, ventral root. That's the spinal nerve, spinal nerve. So we've taken a section through the spinal cord. That's a section through the spinal cord. So what do we call this as? This is the dorsal horn. That's the ventral horn. Dorsal horn, ventral horn. We know this. The dorsal horn gives rise to the dorsal root. Dorsal root. The ventral horn gives rise to the ventral root. So dorsal root, ventral root. And what do we get here is a spinal nerve. Spinal nerve. We know this. We get this as a spinal nerve. So this is a normal section of the spinal cord: dorsal horn, dorsal root, ventral root, spinal nerve. Now, when we talk about sympathetic and parasympathetic nervous system, so sympathetic nervous system is what in origin? Thoracolumbar and outflow. Thoracolumbar. Sympathetic nervous system begins from T1 to L2 segments of the spinal cord. Means thoracic 1, T1, T2 till T12, L1, L2. So T1 to L2 segments of the spinal cord, what begins is the sympathetic nervous system, right? So if we take a section from T1 to L2 segments of the spinal cord, students, we get an extra horn here. We get something extra here. So this is the dorsal horn, that's a ventral horn. We get an extra horn here. This is what we call as the lateral horn. Lateral horn. Now, this lateral horn would be present in T1 to L2 segments of the spinal cord. And this lateral horn would be giving rise to, this lateral horn will be giving rise to the sympathetic nervous system. Sympathetic nervous system. Now, students, you know, sympathetic nervous system has got two types of fibers. One is the preganglionic, one is the postganglionic fiber. We know this. So when we say sympathetic nervous system is thoracolumbar and outflow, that means what is thoracolumbar and outflow? The preganglionic fibers. Preganglionic fibers. The preganglionic fibers of the sympathetic nervous system begins in the lateral horn cell of T1 to L2 segments of the spinal cord. They pass through the ventral root, they enter the spinal nerve, right? And now they would be going to, what is this, students? One moment, what is this? This is the sympathetic chain, right? That's a sympathetic chain. Sorry, that's a sympathetic chain like this. On either sides of the vertebral column, we've got the sympathetic chain. So the preganglionic fibers begins from the spinal cord. There is an extra provision here. There's a lateral horn. The fibers would pass through the fibers would begin from the lateral horn cell, would pass through the ventral root, would enter the spinal nerve, and from the spinal nerve, now they would be going to this sympathetic ganglion. The fibers, the preganglionic fibers would be going to the sympathetic ganglion. Now the fibers cannot just go. They cannot go on their own. There has to be someone to carry the fibers, right? There has to be someone to carry the fibers. So these fibers are carried by someone. What is this someone known as? This is known as the white ramus communicans. White ramus communicans. So what does the white ramus communicans do? They carry the preganglionic fibers from the spinal nerve to the ganglion. So the preganglionic fiber has gone to the ganglion. The fiber will relay in the ganglion, and what begins from this ganglion now would be the postganglionic fibers. The postganglionic fibers would begin from this ganglion, and they would enter the spinal nerve, and they would supply the organs. They would supply the organs. They would supply the blood vessel organs, and they will supply the sweat gland. Okay. They would supply the blood vessels, they will supply the organs, and they will supply the sweat gland. What are these fibers? Postganglionic fiber. This postganglionic fiber has to be carried by someone from the ganglion to the spinal cord. So these are the gray ramus communicants. So what does the gray rami communicants do? They carry the postganglionic fiber from the sympathetic ganglion to the spinal nerve. Now, where are the ganglions of sympathetic nervous system located? Very close to the vertebrae. So the preganglionic fiber is very small and the postganglionic fiber is too long. They're very long. Postganglionic fibers are very long, right? So that's about the sympathetic nervous system. Preganglionic, postganglionic fibers. I've just told you in short. Now just try to compare this with the parasympathetic nervous system. Sympathetic nervous system is thoracolumbar outflow. It begins from T1 to L2 segments of the spinal cord. So from T1 to L2 segments, there's an extra horn here. We call this as lateral horn, right? Now understand the parasympathetic nervous system. Parasympathetic nervous system. Parasympathetic nervous system, students, what is the outflow? Where does it begin from? Craniosacral and outflow, right? It begins from the brain, it begins from the sacral part of the spinal cord. Now, which part of the spinal cord? S2, 3, 4. S2, 3, 4. That means, students, if I take a section from S2, S3, S4 levels of the spinal cord, again, I get a lateral horn here. And this lateral horn in S2, S3, S4 will give rise to fibers, right? This lateral horn cell in case of S2, S3, S4 will give rise to the preganglionic fibers, but of parasympathetic nervous system. Are you able to follow this? So the preganglionic fibers of the parasympathetic nervous system begins in the lateral horn cell of S2, 3, 4 segments of the spinal cord. Again, they pass through the ventral root, they enter the spinal nerve, and now they go to the ganglions. Now, where are the ganglions of parasympathetic nervous system located? They are located very close to the organs, or they are located in the walls of the organs. So the preganglionic fiber becomes very long and the postganglionic fiber becomes very short. Are you able to follow this? So the sacral outflow of the parasympathetic nervous system, begins from S2, S3, S4. This is also known as nervi erigentis. Nervi erigentis. It is also known as pelvic splanchnic. Okay, we are not much concerned about the sacral part. What is important for us here is the cranial outflow of the parasympathetic nervous system. Now, where does this cranial outflow of the parasympathetic nervous system begin in? It begins in the brain. It begins in the brain or the brain stem. You can say it begins in the brain stem. Okay, that means the brain stem will have nucleus. And what would begin from the brainstem are the preganglionic fibers. You understanding? In other words, the preganglionic fibers of the parasympathetic nervous system, the cranial outflow is located in the brain stem. Like the sacral outflow was located in the spinal cord, the cranial outflow of the parasympathetic nervous system is located in the brainstem. What would begin from here? What would begin from here are the preganglionic fibers. Preganglionic fibers would begin from the brainstem. Are you following this? Now, this preganglionic fibers would be coming to a ganglion. The preganglionic fibers would be coming to a ganglion. Students, which are the ganglions of the cranial outflow of the parasympathetic nervous system? Cranial outflow. We have seen 4 ganglions. We have seen the ciliary ganglion in the orbit. I have shown you the pterygopalatine ganglion in the pterygopalatine fossa. 2 ganglions, you know. 2 more ganglions. One is the submandibular ganglion and the other one is the otic ganglion. So these are the 4 ganglions of the parasympathetic nervous system which outflow cranial outflow. You understanding? So the ganglions are ciliary, otic, pterygopalatine and the submandibular. So So these are the ganglions. I will be going into this details. Just try to understand this. Clear? So the preganglionic fiber of the we're discussing parasympathetic nervous system. Which outflow? Cranial outflow. We are interested in cranial outflow. So the preganglionic fibers, where would they begin from? Brain. When we say brain, it's actually the brain stem. There will be nucleus of the cranial nerves. So this preganglionic fibers would be coming to the ganglion, and who's going to carry this preganglionic fibers? This preganglionic fibers would be carried by cranial nerves. This preganglionic fibers would be carried by the cranial nerves. Which cranial nerves? Carried by 3, 7, 9 and 10 cranial nerves. 3, 7, 9 and 10 cranial nerves. Okay. So one moment, I'll just clear this. Carried by 3, 7, 9 and 10 cranial nerves. Okay. So where does the preganglionic fiber begin? In brainstem. Who's going to carry the preganglionic fibers? The cranial nerve, 3, 7, 9 and 10 cranial nerves. They are going to come in the ganglions. Now, which are the ganglions? We have got 4 ganglions: ciliary, otic, pterygopalatine and submandibular. Now, what will begin from this ganglion? Students, what will begin from this ganglion are the postganglionic fibers. The postganglionic fibers would begin from this ganglion. And what are these postganglionic fibers going to supply? They supply the glands. They supply the glands. Are you able to follow this? In other words, who's going to supply the glands of the head and neck? The parasympathetic nervous system. Which outflow? Cranial outflow. So all the glands in the head and neck would be supplied by the cranial outflow of the parasympathetic nervous system. Now, which are the glands of the head and neck? The submandibular, the sublingual glands, the parotid gland, the lacrimal gland, the nasal gland, the palatine glands and the pharyngeal glands. So this is all the glands in the head and neck. And who's going to supply this? The cranial outflow of the parasympathetic nervous system. Who's going to carry the preganglionic fibers? 3, 7, 9 and 10 cranial nerves. These nerves would come and relay in the ganglions. Now, which ganglions? Otic, ciliary, pterygopalatine and submandibular. And the postganglionic fibers would now supply the glands. Are you able to follow this? In other words, what is this cranial outflow of parasympathetic nervous system going to supply? The glands. The glands. Okay, I'll just mention a statement for you. Just have a look at this. A very important statement. All the glands in the head and neck are supplied by, all the glands in the head and neck are supplied by, yes, which nerve? Facial nerve. All the glands in the head and neck are supplied by facial nerve except the parotid, except the parotid gland, which is supplied by glossopharyngeal nerve. Okay, so all the glands in the head and neck are supplied by facial nerve except the parotid gland, which is supplied by glossopharyngeal nerve. Okay, the glands, what is the vagus supply? The vagus supplies the glands of GIT. The glands of GIT. See, what are we discussing, students? Don't get confused. We are discussing the parasympathetic nervous system, cranial outflow. What does it supply? Glands. Who's going to carry this? 3, 7, 9 and 10. Out of this, what glands does the 7th nerve supply? All the glands in the head and neck. I just told you. What glands is the 9th nerve going to supply? Parotid. What is the 10th nerve going to supply? The glands of GIT. Perfect. But there's only one exception. What's that? The 3rd nerve. There's only one exception. The 3rd nerve does not supply any gland, but the 3rd nerve supplies 2 muscles which are parasympathetic in nature. The 3rd nerve supplies 2 muscles which are parasympathetic in nature. That's the sphincter pupillae. The sphincter pupillae and ciliaris. sphincter pupillae and ciliaris muscle. Are you able to follow this? The only exception is third nerve. Third nerve does not supply any glands, but third nerve supplies two muscles which are parasympathetic in nature, the sphincter pupillae and the ciliaris muscle. Okay, students, clear? Understanding this, or is it confusing? Look, we are discussing parasympathetic nervous system. That is the lecture. Which outflow? Cranial outflow. Just remember, this cranial outflow is going to supply the glands. Who's going to carry this 3, 7, 9 and 10 cranial nerves? These nerves would begin from the brainstem. They would come to a ganglion, and from this ganglion, they would supply the glands. Now, I'll make it easy for you. Look, say we're talking about the facial nerve. Where does the facial nerve begin from? Brainstem. Now, which part of the brainstem? That we'll see later. We're discussing the facial nerve. Facial nerve begins from the brainstem. What are these fibers, students? What are these fibers? These are the preganglionic fibers. Now, this preganglionic fibers would be coming to a ganglion. Now, this facial nerve is related to two ganglions. One is the pterygopalatine ganglion and the second one is the submandibular ganglion. Pterygopalatine and the submandibular ganglion. Once the fiber relay in these two ganglions, pterygopalatine and submandibular, what would begin from this ganglion? Are the postganglionic fibers. These are the postganglionic fibers. And what is this postganglionic fibers going to supply? This postganglionic fibers will supply all the glands. Now this we'll see now, except parotid. It supplies all the glands except parotid. Clear to all of you? So this is a brief outline about the parasympathetic nervous system. Okay, that's the seventh nerve. Preganglionic fibers goes to the ganglion. Now, which ganglions are related to the seventh nerve? The pterygopalatine and the submandibular. And the postganglionic fibers supply the glands. Now, coming to the next nerve, ninth nerve. Ninth nerve begins where? Brainstem. What are these fibers? Preganglionic. What is the ganglion of ninth nerve? Otic ganglion. The ninth nerve will relay in the otic ganglion. The postganglionic fibers would supply what? Parotid gland. Are you following this? So in other words, what is the cranial outflow going to supply? The glands. Now coming to the next nerve. The next nerve is the 10th nerve. Or we will come to the third nerve. Third nerve begins in the brainstem. The preganglionic fibers comes to a ganglion. What is the ganglion? Ciliary ganglion. The postganglionic fibers, no, it doesn't supply any glands, but it supplies two muscles. What is that? Sphincter pupillae and ciliaris muscle, right? And coming to the last one, 10th nerve. 10th nerve begins from the brainstem. The 10th nerve begins from the brainstem. The 10th nerve does not have any ganglions. No ganglions for the 10th nerve. It directly goes and supplies the glands of GIT. It directly supplies the glands of GIT. The 10th nerve relays in a plexus, which is known as the Meissner's and the Orbach's plexus. That's in the wall of GIT. So 10th nerve begins from the brainstem, relays in the Meissner's and the Orbach's plexus, and the postganglionic fiber is going to supply the glands of GIT. Okay, students, that's a brief outline about the parasympathetic nervous system, about the ganglions, about the glands. Just have a look at this slide. Now, what is this ganglion? That's the ciliary ganglion. What is this ganglion? That's the pterygopalatine fossa. That's the pterygopalatine ganglion. In the pterygopalatine fossa. What is this ganglion? That's the submandibular ganglion. And what is this ganglion? Otic ganglion. Right? These are the four ganglions in the head and neck. Now, students, this is how a ganglion looks. That's how a ganglion looks. This is a ganglion. Okay, that's a ganglion. Now, the ganglion cannot just hang like this in the air. The ganglion cannot be just like that in the air. The ganglion needs to be suspended from something. So the ganglion is hanging from a nerve. The ganglion is just hanging from a nerve. It has got nothing to do with the nerve. It is just hanging from the nerve. And if a ganglion is hanging from the nerve, this relation of the ganglion is what we call as structural relation. So what is structural relation? The ganglion is just hanging from the nerve. This is what we call as structural relation. And second, the nerve is coming from the brainstem. The nerve relays in the ganglion. The nerve sends postganglionic fibers, and this is going to supply the glands, right? So the nerve begins from the brainstem. The nerve comes in the ganglion, relays in the ganglion, and sends postganglionic fibers to supply the glands. If this is it, this relation is what we call as the functional relation. This is what we call as the functional relation. Are you understanding this? What is structural relation? What is functional relation? So one is structural and one is functional. What is structural? The ganglion is just hanging from the nerve. That is structural. And this another nerve which enters the ganglion, which relays in the ganglion and which sends postganglionic fibers to supply the gland. What is that? That's functional relation. That is functional relation. Let me just tell you this. Look, there are 4 ganglions. One is pterygopalatine. I'm writing in shorter. Pterygopalatine is also known as spinopalatine. Same name. Pterygopalatine or spinopalatine. The second one is ciliary ganglion. Ciliary. We have seen this ciliary ganglion. Next is otic ganglion and the submandibular ganglion. So pterygopalatine, ciliary, otic, and submandibular ganglion. These are the 4 ganglions of head and neck. Now, each ganglion is related to 2 nerves. We just seen this. One is structural. Okay, one is structural relation and the second one is functional relation. Structural and functional. Now, structural meaning the ganglion is hanging from the nerve. So students, the pterygopalatine ganglion is hanging from which nerve? The pterygopalatine ganglion is hanging from maxillary nerve. The pterygopalatine ganglion is suspended from the maxillary nerve. The ciliary ganglion is hanging from nasociliary nerve, nasociliary. The otic ganglion is hanging from mandibular nerve, and the submandibular ganglion is related to lingual nerve. Okay, so you understand. I'll show you this. Pterygopalatine ganglion is hanging from which nerve? Maxillary nerve. Ciliary ganglion is hanging from nasociliary nerve, otic from mandibular, and submandibular from lingual. What is common in all this? Students, what is common in all this? We've already seen this in the previous lecture. What is common in all this? All this are branches of trigeminal nerve. All these are branches of trigeminal nerve. Maxillary is a direct branch. Mandibular is a direct branch of trigeminal. Lingual is a branch of mandibular. And nasociliary is a branch of ophthalmic. So all the ganglions are hanging from one of the branches of trigeminal nerve. Is this clear? They're just hanging. And now see the functional relation. What does functional mean? The nerve would begin from the brainstem, come to the ganglion, relay in the ganglion, and send postganglionic fibers to the gland. This is actually parasympathetic nervous system. So what is this? This is 7, 3, 9, and 7. 7, 3, 9, 7. This is what I'm telling you, students. The 7 now begins from the brainstem, comes to the ganglion. The preganglionic fibers comes to the pterygopalatine ganglion. The fibers will relay in this ganglion, and the postganglionic fibers will supply the glands. And this pterygopalatine, that is structure, that is functional relation. And this pterygopalatine ganglion is hanging from which nerve? Which nerve? Maxillary. That is structural relation. The facial nerve begins from the brainstem, comes to the ganglion, submandibular ganglion, relays here, and then supplies the submandibular and sublingual glands. What is this? Functional. What is this relation? Functional. And this submandibular ganglion is hanging from which nerve? Lingual. What is that relation? Structural. Understanding what is structural, what is functional relation, students? Is this clear to all of you? Look at this one slide once again. What is this ganglion? Pterygopalatine ganglion. What is this nerve from which it is hanging? Look at this, the nerve from which it is hanging, the maxillary nerve. What is this relation? Structural. What is this ganglion? Ciliary. What is this nerve? Nasociliary. What is that relation? Structural. What is this ganglion? This is the submandibular ganglion. What is this nerve here? Huh? Lingual nerve. That is structural relation. And what is this ganglion? Otic, hanging from mandibular nerve. That is structural relation. Students, am I clear to all of you? What is the meaning of structural? The ganglion is just hanging from the nerve, only hanging. And when a nerve comes from the brainstem, enters the ganglion, relays here, and sends postganglionic fibers to supply the gland, that is what we call as functional relation. I hope this is clear. Okay, let us understand one nerve supply of parotid gland. Let us understand the nerve supply of parotid gland. All these things will be clear to you. Nerve supply of parotid gland. So, now students, tell me, this parotid gland is supplied by which nerve? We've seen this. The parotid gland is supplied by glossopharyngeal nerve. So this glossopharyngeal nerve will have a specific nucleus. Like a nerve supplies many different things. But to supply different things, the nerve has different nucleus. Like glossopharyngeal nerve supplies the tongue. Glossopharyngeal nerve supplies the stylopharyngeus muscle. Glossopharyngeal nerve supplies the parotid gland. So the nerve will have different nucleus for each one of this. A different nucleus for parotid gland, a different nucleus for stylopharyngeus, a different nucleus for the tongue. This we'll see later. Now students, what is the name of the nucleus of the glossopharyngeal nerve in the brainstem to supply the parotid? What is the name of the nucleus? The name of the nucleus is the inferior salivatory nucleus. Inferior salivatory nucleus. That's the nucleus of glossopharyngeal nerve, and this nucleus of glossopharyngeal nerve is going to supply the parotid gland. This is located in the brainstem. From the inferior salivatory nucleus we get the tympanic branch of glossopharyngeal nerve. And this tympanic branch, this we'll see in the parotid also. This tympanic branch of glossopharyngeal nerve is known as Jacobson's nerve. This tympanic branch will join with the sympathetic plexus. Sympathetic plexus are going to supply only the blood vessel, remember. Otherwise, you will tell me this is parasympathetic nervous system. Where is sympathetic come from? So sympathetic supply the blood vessels. So the tympanic branch of glossopharyngeal nerve joins with the tympanic plexus, joins with the sympathetic plexus and forms tympanic plexus. Where is this tympanic plexus located? In the medial wall of middle ear. Tympanic plexus is located on the medial wall of middle ear. From the tympanic plexus, we get a nerve. What's that? Lesser petrosal nerve. Students, this lesser petrosal nerve, have we heard somewhere? Lesser petrosal nerve, have we heard somewhere? Foramen ovale. Excellent. Very nice, students. You are all excellent students. Foramen ovale. This lesser petrosal nerve comes out through the foramen ovale. Look who's come. Look who's come. Our ganglion has come. It comes to the otic ganglion. It relays in the otic ganglion. And now the fibers would go to a gland. What gland? Parotid gland. The fibers would go to the parotid gland, right? Now that's the pathway of nerve supply of parotid. Now students, where is this located? This is located in the brainstem, right? This is located in the brainstem. From the brainstem to this ganglion, from the brainstem to this otic ganglion, these are the preganglionic fibers. And from the otic ganglion to the parotid, what are these fibers? These are the postganglionic fibers. You understanding? The nerve begins from the brainstem. The nerve comes to the ganglion. The nerve relays in the ganglion, and the nerve sends postganglionic fibers. Come on, students. What is this relation? Functional. That's the functional relation, and this is how the glossopharyngeal nerve is functionally related to the otic ganglion. The nerve comes in the ganglion, release and sends fibers to supply the parotid gland. That means who's supplying the parotid gland? The glossopharyngeal nerve. And which is the ganglion related to the glossopharyngeal nerve? Otic ganglion. Are you understanding? So what are these fibers? Preganglionic. What are these fibers? Postganglionic. The same thing I was trying to tell you in the previous slide. Where's the slide gone? Where's the slide gone? Gone. Okay. Look, this was a slide. The ninth nerve begins from the brainstem. The ninth nerve goes to the otic ganglion. These are the preganglionic fibers. The postganglionic fibers supply the gland. That's the functional relation. And this otic ganglion is hanging from which nerve? Mandibular nerve. That is its structural relation. Structural. Clear, students? Let me tell you one more thing. So this will be very clear to all of you. Let me tell you one more thing. Okay, we'll start with the facial nerve. Let us understand the facial nerve. So this will be clear. Now, facial nerve, what does it supply? All the glands in the head and neck. Clear? Facial nerve supplies all the glands in the head and neck. Facial nerve is functionally related to two ganglions, the pterygopalatine and the submandibular. Clear? Facial nerve is functionally related to two ganglions, the pterygopalatine and the submandibular. Supplies all the glands. This much we know. Understand the codes of facial nerve. Now, facial nerve, like glossopharyngeal nerve, had a specific nucleus for the parotid. Similarly, the facial nerve will have a specific nucleus to supply the glands. The name of this nucleus is the superior salivatory nucleus to supply the glands. And there's a gland here, we cry. That's gland lacrimal. The name of the nucleus, lacrimatory nucleus, lacrimatory. Okay, so I'll just write the superior salivatory nucleus for you. Lacrimatory I'm not writing here. Superior salivatory nucleus, that's the nucleus of facial nerve. It's sensory branch. I'm writing in small letters, sensory branch, because the pathway is big. Sensory branch of facial nerve. Any idea what is the sensory branch of facial nerve known as? It is known as the nervus intermedius. Nervus intermedius, or the nerve of Wrisberg. Remember this, that's a very important MCQ. Nerve of Wrisberg, W-R-I-S-B-E-R-G, nerve of Wrisberg. So sensory branch of facial nerve is known as nervus intermedius or the nerve of Wrisberg. This sensory branch of facial nerve will join with the motor branch. Sensory branch will join with the motor branch and will form the trunk of the facial nerve. Trunk of the facial nerve. Okay. So sensory branch is a different branch of facial nerve. Motor branch comes from a different nucleus. Sensory branch comes from the superior salivatory and the lacrimatory nucleus. Motor branch comes from a different nucleus. Together they join to form the facial nerve. Now this facial nerve enters into a foramen. Come on, students. The facial nerve is entering into a foramen of the skull. Internal acoustic meatus. And when it enters the internal acoustic meatus, it enters into the internal ear. Internal ear. From the internal ear, the facial nerve comes in the middle ear. It undergoes a bend. And what is this bend known as? The genu. And this genu is a bend, but we call it as the geniculate ganglion. Okay, so trunk of facial nerve enters into the internal acoustic meatus, enters the internal ear, bends, comes in the middle ear. That's the genu. This is what we call as the geniculate ganglion. From this geniculate ganglion, we get three branches. One is the greater petrosal nerve. Greater petrosal. Second is nerve 2 stapedius. And third is chorda tympani. Greater petrosal nerve, the nerve to stapedius and chorda tympani. And after giving these three branches, the facial nerve now gets out through the stylomastoid foramen. It gets out through the stylomastoid foramen. It enters a gland here. What is this gland here? The parotid gland. Okay. So the facial nerve first gives this three branch in the ear. After giving this three branch, the facial nerve gets out through the stylomastoid foramen, and that's the parotid gland, enters the parotid gland, and then it gives five branches. It gives five branches to supply the muscles of facial expression. We know this, right? So from the geniculate ganglion, this 3 branches then gets out through the stylomastoid foramen, enters the parotid and gives this 5 branches to supply the muscles of facial expression. Now, we'll trace the chorda tympani. Chorda tympani joins with, we know this, it comes and joins with the lingual nerve. Lingual nerve goes to a ganglion. What is that ganglion? That's a submandibular ganglion. That's a submandibular ganglion, and it now supplies 2 glands. So chorda tympani joins with the lingual, goes to the submandibular ganglion and supplies the submandibular and the sublingual gland. Submandibular and the sublingual gland. Okay. So greater petrosal nerve, nerve to stapedius, chorda tympani, and then it gets out. Chorda tympani joins with the lingual, goes to the submandibular ganglion and supplies the submandibular and the sublingual glands. Greater petrosal, students, this greater petrosal nerve joins with deep petrosal nerve. I told you this, it comes from the sympathetic plexus around the internal carotid artery. We have seen this in foramen lacerum. So greater petrosal nerve joins with the deep petrosal nerve, which comes from the sympathetic plexus around the internal carotid artery, forms the nerve of pterygoid canal. Nerve pterygoid canal, it is nerve pterygoid canal, also known as Vidian's nerve. Nerve pterygoid canal or the Vidian's nerve. Now this nerve pterygoid canal will come and relay in the pterygopalatine ganglion. Right? So greater petrosal nerve, which is a branch of facial nerve, joins with the deep petrosal nerve, which comes from the sympathetic plexus around the internal carotid artery, forms the nerve pterygoid canal or the Vidian's nerve, relays in the pterygopalatine ganglion, and the postganglionic fibers are now going to supply the lacrimal, nasal, palatine, and the pharyngeal glands. Okay, lacrimal, nasal, palatine, and pharyngeal glands. So that's the complete pathway of facial nerve. Students, clear? Now you tell me one thing. Now try to understand this. Tell me, okay, where is this located? Where's the superior salivary nucleus located? Brainstem. From the brainstem, this fibers, and that's the ganglion. What are these fibers? The preganglionic fibers. And what are these fibers? The postganglionic fibers. What is this relation? Functional. Again, this is in the brainstem. From the brainstem, what are these fibers? Preganglionic. That's the ganglion. What are these fibers? Postganglionic. What is this relation? Functional. You understanding how the pterygopalatine and the submandibular ganglions are functionally related to the facial nerve? Clear with this? Look at this. What does this mean? All the glands in the head and neck. This is all the glands in the head and neck are supplied by which nerve? Facial nerve. Now, why it does not supply the parotid? There's a reason for this. All the glands, otherwise these are all the glands in the head and neck are supplied by facial nerve. This is what I told you. It doesn't supply the parotid. Yes, it has got a reason for that. That I'll tell you later. Clear now, students? What is structural, what is functional relation is clear? This pterygopalatine ganglion is hanging from which nerve? Maxillary nerve in the pterygopalatine fossa. What is that relation known as? Structural, because it is hanging. The submandibular ganglion is hanging from which nerve? Lingual nerve. So that is a structural relation. Whereas what is this? Functional relation. Students, fine now? Difficult, eh? So understand one thing. The parasympathetic ganglions or the ganglions of the head and neck, what are they meant to supply? The glands. Only the ciliary ganglion doesn't supply any gland. It supplies 2 muscles, the sphincter pupillae and ciliaris muscle. Ganglions are related to 2 nerves. One, it is hanging from a nerve. That's structural relation. Second, nerve comes from the brainstem, relays in the ganglion, sends postganglionic fibers. That is functional relation. Clear to all of you? I've told you the pathway of facial nerve. I've told you the pathway of glossopharyngeal nerve to understand the same. So I hope this ganglion is clear to all of you. Look at this slide. Look at this slide. That's a beautiful slide. So now tell me, what is this ganglion? What is this ganglion that you're looking at? That's the pterygopalatine. What is this nerve? Maxillary. What is this relation? Structural. What is this ganglion? That's a submandibular ganglion. What is this nerve? Lingual nerve. What is this relation? Hanging. So structural. That's a ciliary ganglion. What is this nerve? Nasociliary nerve. So what is this relation? Structural. That's the otic ganglion hanging from mandibular nerve. Okay. Now understand this now, students. What is this nerve? That's a facial nerve. The facial nerve, that's the internal acoustic meatus in the ear. The facial nerves come in the ear. It gives number one, that's a greater petrosal. Nerve to stapedius is not shown. This is the chorda tympani. The facial nerve now gets out through the stylomastoid foramen. What is this? The chorda tympani goes and joins with the lingual nerve, now goes in the submandibular ganglion and will supply the submandibular and the sublingual glands. The greater petrosal, you can see this dotted one, greater petrosal, it comes from behind the artery. Look at this, that's a greater petrosal nerve. That's the internal carotid artery. That's the sympathetic plexus. Around the internal carotid artery, we get a nerve here. See this? That's a deep petrosal nerve. So deep petrosal joining with greater petrosal, that's the nerve of pterygoid canal or the Vidian's nerve. Relays in the pterygopalatine ganglion. And what are these now? These are the postganglionic fibers which supply the nasal glands, the palatine glands, the pharyngeal glands, and the lacrimal gland. I hope I'm very clear, students. That's a very important slide for you. A beautiful slide that is there, showing all the ganglions and showing the relations of the ganglion, structural and functional. Clear? Now answer this MCQ. Otic ganglion is anatomically related to. Yes, otic ganglion is anatomic, means it is hanging from which nerve? Otic ganglion is related to the mandibular nerve. Mandibular. We've seen this. Lesser petrosal nerve derives its preganglionic fibers from. Yes, which is the, yes. Can anyone answer this? Lesser petrosal nerve belongs to which nerve? Glossopharyngeal nerve, right? So answer is going to be the glossopharyngeal nerve. That's the tympanic nerve. Tympanic branch of glossopharyngeal nerve, right? Nervus intermedius is what? That's the sensory branch of facial nerve. Nervus intermedius or the nerve of Risberg, that's the sensory branch of facial nerve. Chorda tympani is a branch of facial nerve which is given in the ear, comes and joins with the lingual nerve. This chorda tympani supplies special sensations to anterior 2/3 of the tongue. That's chorda tympani. Joins with the lingual. In allergic rhinitis, the lacrimation, running nose and pharyngeal drip, which nerve when irritated gives rise to a similar picture. So students, what happens, this, one moment, I'll just show you this. What is this nerve? The Vidian's nerve. Where is that gone? The nerve pterygoid canal or the Vidian's nerve. Suppose if you irritate this Vidian's nerve, this nerve pterygoid canal or the Vidian's nerve, if we irritate this Vidian's nerve, we'll be getting secretions from lacrimal gland, we'll be getting lacrimation, we'll be getting nasal running nose, we'll be getting pharyngeal drip. So if we irritate this Vidian's nerve, we get lacrimation, we get running nose, we get a pharyngeal drip, and all the symptoms are seen in allergic rhinitis. Right. So which nerve when irritated gives rise to one moment. Which nerve when irritated gives rise to symptoms of allergic rhinitis? Your answer is the Vidian's nerve. Vidian's nerve. Vidian's nerve. Clear, students? I hope this is clear to you. So in this lecture, we have discussed the autonomic. In short, I've told you sympathetic and we have discussed the parasympathetic nervous system in details. Parasympathetic is craniosacral. Sacral part, we don't concentrate much. Cranial part arises in the brainstem, carried by 3, 7, 9, 10 cranial nerves. They relay in the ganglion, and from the ganglion, they are going to supply the glands. Now, which are the ganglions? The otic, the ciliary, the pterygopalatine, and the submandibular ganglions, and the glands, all the glands in the head and neck. Second, the parotid, the glands of GIT, which the vagus supplies. The third nerve does not supply any glands, but two muscles which are parasympathetic in nature, sphincter pupillae and the ciliaris. I hope, students, this lecture is clear to all of you. In case of doubts, do get back to me. This is a difficult lecture, students. Just keep on revising. See the lecture, revise the lecture in subsequent lecture. Again, the next lecture is going to be the functional component, which is another very important lecture. Thank you to all of you. Thank you and happy learning. Thank you.